All right, let's click this little button here. It says go live. Okay, it says that we are live for our special board meeting. Board President Golick, you have the YouTubes.
Thank you, John. So this meeting is being held tonight over our YouTube via Executive Order N29-20, which authorizes local legislative bodies to hold public meetings via teleconference and to make public meetings accessible telephonically or otherwise electronically to all members of the public. Members of the public are encouraged to observe and participate in the teleconference. Further public participation. I'm sorry. Further instructions are available at the end of the agenda, but essentially feel free to send an email in to admin@westlakecharter.com with the item number you wish to discuss. And tonight that's easy because we really only have the one item, but feel free to put that in the subject line and then provide I would request a single comment of 250 words or less, and that would be very much appreciated. John, any other housekeeping stuff you can think of at this point?
No, I think we're good. I can. I hadn't seen any comments come into the email, but I have it open in case they do.
Okay, and if by chance someone's calling in or wants to make a number or anything like that, just raise your hand and we'll try to keep track of all the comments that are coming in out from, I think you call it YouTube Landia. Is that what you call it, John?
Yes.
As this meeting progresses. So with that, Amy, will you please take a roll call?
Yes. Hope?
Yes.
Sean?
Yes.
Nancy?
Yes.
Josh?
Yes.
Michelle? I'm sorry, I didn't hear. Michelle? Sorry.
Yes.
Okay. Vasa?
Yes.
Ashley?
Yes.
Shannon? And Jed?
Yes.
Okay. With that, we'll do celebrations. I'm just going to go with an order that's on my screen. And so, Amy and then Jed.
I will celebrate a PD that was organized for us yesterday by John and Steve and Jen Caillou, I believe. It was a very fabulous PD session where we were able to ask questions of educators who have already reopened their campus. And our teachers were given an opportunity to ask some of those burning questions that we don't know because we haven't reopened yet. And then we also had some guest, Dr. Casarie, is that right, John?
Mm-hmm.
And Dr. Atwell, who were able to answer some other questions for our teachers. And I just found it to be really thoughtful of them for giving us that opportunity to ask questions that we would not normally be able to ask. So thank you to those three amazing people.
Thanks, Amy. Jed, and then Michelle.
I'm celebrating that I have a great advocate and a daughter who badgered me for weeks that she thought that I qualified as an educator and should be able to get a vaccine. And I told her I did not think so, and I was looking for any kind of formal recognition that a board member at a charter school would actually meet the definition of educator. And that led me finally, after weeks of badgering, to be reaching out to John, who then did some research and found out that we do qualify. And I got my first vaccine this morning. So thanks to my daughter for her assertiveness, which I think she learned in great deal at Westlake. And thank you for Westlake being a key partner in all this as well. Thank you very much.
Thanks, Jed. Michelle, and then Vasa.
I just want to celebrate all of the work that it took to get here today, where we are actually having a conversation about a plan, not just the work of kind of our Westlake staff and all of the great work that you all do, but all of public health's work and all of the different partners that are contributing to getting the virus under control.
I'd like to celebrate. I had my vaccination today and just celebrate Natomas Unified School District and the team of volunteers that put that together. I have honestly never been to something as organized. I don't think in my life. It was the most organized thing I've ever seen, and usually that doesn't happen in the medical field. And also, of course, then I looked to my left and I saw none other than Nancy Kong Vasquez sitting there, and I realized why it was so organized. So
I know they put her on Excel spreadsheets, Vasa, which made me laugh because talk about identifying a volunteer's core skill. Sorry, I just had to share that 2 cents there. Josh and then Shannon.
Yeah, I want to just go back a couple weeks. I want to celebrate the positive parenting webinar that was put together. I learned a lot. So there was a lot of good information in there, and I myself have been using those tools. So I know I missed the boat on the last meeting, but I wanted to make sure to celebrate that because I've been waiting to celebrate it for a couple of weeks now. So that it was good stuff. So thank you for putting that out there for the parents, because I can't speak for everybody, but I sure as heck needed it. So thank you.
Thanks, Josh. Shannon and then Ashley.
I'm also going to celebrate vaccines because I had not even been remotely thinking that there was any way I would be anything but dead last to get a vaccine. And so just, realizing that, again, as part of this board and the work that you all have done too, like Deb said, I didn't know the backstory, so thanks to your daughter too, but to John and all the work to, ask and find out if we were eligible. And then, seeing how organized it was today, my mind was blown. I pulled up and was like, oh, there's a lot of people. Wow, this is incredibly efficient. Then heard Hope's voice and was like, oh my gosh, Hope. So it's good to see you from a distance in person. And then, I just had to give a special little shout out celebration, send a text to Chavez. I was like, who knew 4 years ago when you invited me to participate on this board that it ended up in the middle of the pandemic getting vaccines, but thanks. This is awesome. So very, very happy. I was very impressed with you guys.
Thanks, Shannon. Ashley and then Sean.
I think this whole pandemic, the board continues to celebrate. I've heard people throughout each iteration celebrate that Westlake keeps being Westlake. So one of the things that we have always provided our teachers is time on assessment days to really see how students are doing and do one-on-one check-ins and make sure our students shine and are able to do their best no matter what, so that their grade speaks to their ability. And so this week was our final assessment before report cards come out. I can't believe we're about to do our second report card where this year went. But getting time one-on-one with my littles and to see them grow and to see how much they grew. I even got to do running records with some of my kids who I knew were higher. And for those of you who know me, I'm kind of reading geek when it comes to students and progress, and to see those kiddos use all their skills independently without support and jump into some I have kinders who are doing first grade reading skills. And so we're doing the right thing, even though we've had to do it from home, and to see our kiddos shine. And it's been great. So it's been exciting to spend some quality one-on-one time with my littles, and for them to just get out what they need to say without anyone interrupting them too. So celebrating assessment days.
Thanks, Ashley. Sean and then Steve.
So I will celebrate the fact that I got my second COVID vaccine last week. And I did not feel as if I had been hit by a truck, which is nice. But it's also nice that had I not been able to get it through the method that I got it, which was by driving to Clear Lake to Evan's work, that I would have been able to get it as a board member, which was unexpected and truly lovely. So I am appreciative of that also.
Steve?
Hey, good evening. I will celebrate also the vaccine clinic, but really about the partnership we have with NUSC. We're on weekly phone calls with other charter leaders in the area, And when they hear kind of what we're doing locally, and that we have staff and substitutes and vendors who are supporting the campus getting the vaccine, their mouths drop. So again, just a quick shout out to our partnership and the availability of the vaccine to those in the education community.
Thanks, Steve. I'm also going to celebrate the vaccine clinic. And I would urge all board members, if you get a chance to volunteer, to go out and just see it in process. It's a long day being there from like 7 to 1:30, but your heart is full afterwards because so many people are they're just so thankful to have the opportunity, and the smiling faces, having not seen many people, and I'm pretty introverted, so it was a lot of peopling, I'm not going to lie. It just felt so good, like we were making a difference. And so I believe Natomas Unified routinely opens up a certain number of shots on the Tuesday before the Thursday clinic at 9 a.m. So I would just, for listeners out there or watchers who are looking for a shot, to check NUSD's website. It's a wonderful clinic. And then if you need a ride to the clinic, both YOLO Bus and SAC-RT are offering free bus rides to vaccine clinics. And so there's a lot of opportunities out there. And if anyone needs help with resources, feel free to reach out. I'm willing to try because it's just such an important thing for our whole community and our family. Just stay healthy and safe. So with that, John, do you want to celebrate?
Yeah, I've got plenty of celebrations in the slideshow, and obviously I'm going to, one of those slides will be about the COVID clinic because I got to volunteer today. So I'll save mine for then because it was a great event.
Well, and John also got the perfect job for him. Because he got to say goodbye to everybody as they left, and I'm sure loved it.
It was great.
Yeah.
I got to wave traffic out, and I saw so many people that I knew. I've been in Natomas as an educator for over 20 years, and I felt like it was homecoming week. I just saw so many people that I knew. It was great.
Yeah. So, John, are there any other board comments for items not on tonight's agenda?
I don't get to celebrate.
Oh, Nancy, I'm sorry. You weren't on my screen. I apologize.
Oh, sure. It's okay.
We did get our shots together today, so maybe I'm just blacking you out.
Hope has seen enough of me today is what she just alluded to essentially. But I'm going to celebrate anyway because I can't keep quiet when it comes to this kind of stuff. So I did want to also celebrate the vaccination clinic. And here I was thinking, I'm I'm going to get to say it before everybody else, but it didn't happen. It's fine. It was a long day, but as Hope said, it was very fulfilling work to know that you contributed to 1,100 people getting vaccinated today. It had the same feeling for me working at a voter poll on election day. Same kind of feeling, just felt really long day, but just grateful for the opportunity. And our partnership with NUSD extends past the vaccination. They have returned to school in a lot of their traditional campuses in the last couple of days with orientations. So I think that, just their planning also folds into, a little bit of feedback and an opportunity to see how things worked at their campuses for our own reopening. So for that, I'm grateful, and grateful as always to be part of this community.
Thanks, Nancy. I really am sorry.
Oh, sure.
I just only have so many video screens, and I was trying to cross-check ABCs. I'm super sorry.
All good. I was the master of the spreadsheet. I just want to let you know for today, and your name was on there, so just wanted to throw that out there.
Thank you. With that, John, do we have any public comments for items not on tonight's agenda?
No, ma'am.
Oh, Ashley, you had another comment? Okay. Sorry.
I did have a comment, and Nancy jumped in. Nancy, let's blame it on Google. I'll get Hope some popsicle sticks because that's how I make sure I don't miss any of my kids. Right now, when I can't see they're all there, it's not her fault.
That's smart. All right.
But my comment is it sounded like Hope when you were celebrating that maybe the clinic is opening up to more than just teachers. And I just wonder, I know I've been reading a lot about access, and I did have a family member who's over 60 share with me they haven't been able, and they didn't share the reasons, but they shared with me that they hadn't been able to get their shot yet. So I wonder if, and maybe knowing Westlake, they're already planning to, but maybe that's some information we put in our weekly, or somehow get to our families the details of both the transportation and the clinic, if we haven't already planned to do that.
Very good.
Nods nodding, Ashley, so note made. So perfect, thank you. Since we have no public comment, that brings us to tonight's action item, which is review and approve reopening plan. So John, I'm gonna kick it to you.
Very good, very good. Well, thank you. I will share some slides here and see if I can present. There we go. There we go. Well, thanks everybody. Thank you for being here tonight. I know it's a special board meeting. We have very few specials, so I really appreciate you setting this time aside for this important conversation. It has been quite a week. It has been quite a couple of weeks, and in collaboration with all of our partners inside the organization and outside, I'm really excited to talk about what is about to come next. So we'll just dive right into some celebrations. These are pictures from the Shot Clinic today. It was a fabulous collaboration with our partners at Natomas Unified School District. But Natomas Unified School District partnered with some amazing external collaborators as well. County officials and vaccine providers. We're taking selfies and people are taking pictures. And Amy Wells is on a megaphone counting down 5, 4, 3, 2, 1, inject, and then like 15 needles go into 15 arms, and then those cars move forward. The next 15 come in, and what an orchestration! It was really a wonderful thing to be a part of as a volunteer, and proud to be part of the community doing this. I shouted out because as of today, every single Westlake Charter School employee has had the opportunity to receive their first vaccine, and that includes our vendors like our substitute teachers, our day and night custodial team, and every certificated and classified staff member. So that's it was really a lot of work on behalf of the Natomas Unified School District to make that happen for us, along with their own staff. And I just want to publicly thank our partners at NUSD, because I'm knowing that all of our staff have had that opportunity makes a big difference to our community and for the work we're about to do tonight. Little celebration for our lottery prep work. Lottery happens on Monday night, so over 1,300 people have applied to be a part of Westlake Charter School. And on Monday night, you think, oh, we're going to get our first 9th grade students. Well, little do you know, we launched a form to the 8th grade students and said, hey, it's time to start claiming your spots. And before I came to tonight's meeting, we had just launched the form, and over 35 students had already signed up and said, yeah, count me in for next year. So our 9th grade numbers are adding up, everybody. And on Monday, we will add up to more. We had a high school information night last night where we launched that information that I just talked about. And it was just phenomenal. Just to see our program come together in a quick presentation was a ton of fun. Amy alluded to this. We had a professional development where an educational panel came together from Lighthouse Charter School, St. Hope Public Schools, and Barrett Ranch Elementary School, where they got on a Google Meet, and we kind of did a live stream like you're on right now, and our team got to hear from educators from around the region who've already opened school. We also had a couple of medical experts come on screen and answer some of our tough questions from our staff. Things like, if I am vaccinated, can I still catch COVID-19 and take it home to loved ones? And, they were straight shooters on their answers, and I think it was very helpful for all of us to hear those answers. Let's dive in and talk return to school. I'd like to walk you through quite a few slides, and I want to apologize for that because we are speaking not only to the board, but through the board to our entire community. And I want everyone in our community to know how prepared we are for these next steps before I ask you to accept these plans. You'll see some pictures at the bottom of the screen there because some educators, as I mentioned, let us come out to their schools and visit their school sites. And in doing so, we learned quite a bit about reopening through those visitations. But just a quick summary of the last few weeks. You know that The transmission rate dropped below 25 just 3 weeks ago. It dropped to 24.8. Then the subsequent week, it dropped to 18.7. And as of this week, we are at 15, which is well below the 25 rate, which would allow schools K-6 to open up. Since then, Natomas Unified School District, Natomas Charter School, NP3, Robla, Elk Grove, Sacramento City, West Sacramento have all been announcing reopening dates. So Jed said at one board meeting, hey, we'll know when it's time to open. Well, it feels pretty evident that we feel it's time. Our administrative team went on some visits. We went to Lighthouse Charter School. We went to Barrett Ranch K-5, and we went to St. Hope Public Schools. And I'm going to show you and talk to you about those schools and how those schools kind of help to shape some of our plans. Our admin team, well, we were going to take a February break like everybody, but we spent a lot of time doing some really good work. We revised and reviewed and produced all of the necessary plans, schedules, and assets for reopening. And we started Monday morning this week feeling extremely confident that we could present this plan, our safety plan and our reopening plan, in front of our Westlake Charter School staff and answer any questions that came forward. We've had a really productive week doing this work. And of course, the vaccines. You know, over February break, we sent about, we must have sent 500 text messages to our staff. Okay, click on this form, click on that form. Oh, wait, here's another form. Trying to get everybody to sign up for the vaccine. At first, we didn't know how quickly we were going to be able to work with Natomas Unified. So we were just trying to give everybody access to every vaccine clinic that we could. But through all that diligent work and all the time on the phone talking to our partners, we got 100% of our staff access to the vaccine. We feel really good about that. As Steve mentioned, we acknowledged this to our charter partners on our Friday charter call. And it was emotional because there are many charter leaders in our region who run phenomenal schools with amazing staff members, not unlike our own. And they acknowledged, hey, in our district, we don't have that type of partnership. I was surprised to hear that some districts that actually do have vaccine clinics, like Natomas Unified, did not elect to include their charter partners. And that's really disheartening. So to know that we have a wonderful relationship here that's helped lead to where we are, it's to be celebrated. So I talked about schools opening up. These are the opening dates for our local schools, just keeping it right here in Natomas. The Natomas Charter School called it on March 1st, K-5. NP3 called it March 8th and April 1st for their split because they're doing a staggered. They got kind of caught with a 2-week spring break in there, and so that's why the spread's kind of wide there. The NUSD came out with these really fun little orientation days on the 24th and 25th. The kids came on campus. They didn't get to jam with their teacher, but they got to jam with some other staff and just get to step on campus while their teachers were continuing distance learning. But March 1st is their K2 opening, and March 8th is their 3-6 opening. To be very clear, we can open 6th grades only if they are self-contained. And here at Westlake Charter School, our 6th grade is not self-contained because we are departmentalized. And so when we open, we'll be talking about a K2 and a 3-5 split, and then 6-8 when the county is in the red tier. Things that we considered in building our plan, we had over 100 pieces of individual feedback from our staff. Very important that we were listening to our staff and responding to our staff. Our plans, if you've been listening to our staff, you'll see lots of things in our plans that respond to the needs of our staff, but they also respond to the needs of our families. We had over 300 pieces of individual feedback from our parent survey asking for information like base is a great consideration, that we've adjusted our plans to ensure that base can be available because there's so many people concerned about that in parent feedback. We had months of instructional modeling meetings in collaboration with our instructional leads and our teachers. And we learned a lot from the site visits that we took this last week. Of course, you know, the Center for Disease Control recently released some new guidelines, and we poured over those and tore them apart and put them back together and took pieces and added those to our plan. It was very illuminating. And of course, just the reopening data from the Sacramento County schools, that people who are reopening influenced our plan as well. So our next steps, you know, for this week were on Monday, we spoke with our leadership team, took a lot of feedback and reworked our plans to make sure that they were ready for presentation to our entire staff. On Tuesday, we presented them to our entire staff, but we continue to listen and we continue to take feedback and make iterative tweaks where necessary and make sure that more information was available where needed. We held a 2-hour professional development on Wednesday where I told you we brought in some educators from the outside and some medical experts, again, to help our staff understand what reopening could and should look like. Tonight is our special board meeting, and if the board approves tonight's plan, we would like to communicate with our families tomorrow, releasing our plans to our families so they can start to prepare because it's coming quickly. We are backwards planning from March 15th on our reopening of K2. We're going to stagger K2 in the first week and then open up March 22nd, 3rd through 8th. Now, I should have put a little asterisk there because it's really 3rd through 5th. But if the county is in the red tier and has been so for 5 days, we'll, of course, open 6th through 8th. So I went ahead and put 3rd through 8th with a little bit of optimism and wishful thinking that we'll be in the red tier for 5 days by that time. The Center for Disease Control and the California Department of Public Health are recommending staggered reopenings, we adhered to that because we thought, let's bring these kids on. We have about 60% of our students who want to come back, and they'll come back in the cohorted model, but still bringing on hundreds of students on campus. We think it's okay to start with K2 1 week and then roll up the second week. So by March 22nd, we'll have quite a few kids here on campus. It's very exciting. Our staff is asked definitively for time. They need time to plan and prepare and to rework their models. They've been working day and night, long days, long nights, just to keep up with the pace of distance learning. As Mrs. Patel alluded to, our test scores and our assessments are showing that our kids have been learning. We have a 98% attendance rate. Our reading scores are high. Our math scores internally look high. Our teachers have been doing a great job, but it's because they're spending day and night planning for tomorrow, not planning for 3 weeks from now. So we're going to ask the board to give us 3 days. We're going to ask for March 4th and 5th, which is Thursday and Friday of next week. And our families, we get a 4-day weekend. Then we're going to ask for March 12th, the day before we open, which would give our families a 3-day weekend. That would give our staff 3 full days to prepare. And I'll talk a little bit about some of the preparation work that we're going to be doing during those shutdown times. Obviously, staff need time to plan and collaborate, but we need time to walk our staff through the safety protocols and how to operate on campus. We have not been together as a campus community since last March 11th. And so we're going to need a little time to get our feet on the ground. We've also gone ahead and canceled all non-essential meetings for staff. That's no DNA, PBIS, leadership meetings, all of the meetings we have after school and our ad hoc committees. We've canceled those to give our staff more time to prepare. And we're going to do that all the way through spring break so that from now until opening, that's 3 weeks. And then from opening to spring break, that's 3 weeks. It's 6 weeks of just focusing on nothing but ensuring that our kids are getting the highest quality transition back into school while not missing a beat for those kids who are still doing distance learning. And of course, we have parent and staff education and training all prepped, and you'll see some of that in the slides tonight. The big consideration for us is that this is a massive change. It's funny to say that going back to school is a change. It feels like going back to school is like unchanging. But really, this is a massive change. I mean, handling kids in my class in the morning and doing my distance learning in the afternoon and having 2 separate cohorts, that is a big shift for the kids. It is a big shift for the educators, and we know a lot about managing change, and so we're going to have to work together to manage that change. We use this little matrix here at Westlake Charter School whenever we talk about change. We say that you need trust and vision, skills, resources. We need to understand the payoff and have an action plan to really manifest change appropriately. Our staff buys into this model, and we use this model to craft our language. So when I built this slideshow, I asked our team, around the topic of trust, are we really committed to safety? Can we prove that to ourselves? We went through and we looked at all the layers of safety. Do our staff and our families understand the vision of what we're trying to accomplish? Does everyone feel they have the skills to be successful at this new change? Do we have the resources, especially that resource of time? It's the biggest one in education. We always shortchange the resource of time. Do we understand why we're doing it? What's the payoff? And do we have a plan? And so these slides hopefully will walk you through these pieces. In the area of safety, we are going to be diligent about following the California Public Health guidelines for reopening schools because these are the guidelines that have been adopted by the Sacramento County Public Health Department, who we've been saying are our partners since day one on this. And so I want to walk you through some of these. The California Department of Public Health has said if the transmission rate is below 25, then it's safe to reopen schools, but only safe to reopen schools if we use the 7 layers of safety or mitigation: appropriate mask usage, stable grouping, physical distancing of 6 feet, adequate ventilation, hand washing and respiratory etiquette, symptom and close contact screening, and surveillance or screening testing. These 7 layers are purposefully called layers because there's not one really that's inherently so much stronger or more effective than the other. But when we layer them up, the Center for Disease Control research has recently come out to indicate when you layer these up and do them together, the transmission rates in especially our primary grades, are all but none. I mean, very, very low. What we're finding in the research is that when we do see outbreaks, it's typically brought from the outside in, or in the classroom. If there is transmission, it's typically because the layers of safety are not being utilized. And so our staff is committed to having the safest environment possible by using these layers. Again, just a call out there that for us, 6th through 12th grade can't open until the county is in red. We've been using masks appropriately. This is a picture of our base room. We've had 9 students in that flex room just about every day since August. Our staff have been diligent about mask usage, 6 feet of social distancing, and all the layers of safety. And I'm proud to say that on our campus, there has been 0 transmissions from student to student, 0 transmissions from student to staff, and 0 transmissions from staff to staff. We have had kids on this campus every day since August, and by following these rules, we've kept it safe. I just actually love this picture, so I put it in there because I think it's hilarious. This is a dog telling us how to wear a mask. I wanted to put this language in here because the California Department of Public Health has issued guidance indicating that schools should take so seriously the masking issue that they've issued language that said students may be excluded from school if they do not wear masks or are not willing to wear masks. We do not take lightly the issue of excluding students from school. We are a fully inclusive school. However, if schools are offering distance learning, then they are able to say, hey, if you're not willing to wear a mask, then we will offer you distance learning, but we cannot have you on this campus because of the 7 layers of mitigation and safety. It is layer number 1, and we will ensure that everyone on this campus adheres to it and wears it like the dog in the center bottom there, covering their nose and their mouth. Stable groups are incredibly important. I'll tell you what we've been doing about this. You'll see that little bucket right there. That's at Barrett Ranch, where the food services department places food in the bucket right at the end of the day. And when students walk out, they grab a grab-and-go lunch. Why do they do that? To avoid large groupings in the cafeteria. So anybody who wants a lunch in the state of California right now, you don't need to qualify for free and reduced lunch. You don't have to fill out a form. If you want a free lunch, we will provide you with a free lunch, and there'll be a grab-and-go on the way out. All of our cohorts, A and B, have been designed to keep siblings together, which is a part of stable grouping and helps us with contact tracing. Our middle school classes were specially built this year so that no students left block 1 and then mixed with a different group in block 2. We completely rebuilt our schedule back in July so that when we came back to school, we'd be prepared. You know, it's almost easy to forget how long we've been preparing for this opening day. So many of the things that we are going to present tonight, we've been building or have built back in the summer. Specialties will remain virtual because we cannot have our students leave one classroom and go to another classroom because we need to keep our cohort stable. And recess or activity time is designed to keep the groups together. Students will not be released to the playground. Our day is already short enough. They're going to get a quick activity break guided by their teacher and potentially an outdoor aide, but they will be cohorted with their classroom cohort because we have to adhere to stable groupings for many reasons, including contact tracing. And again, we'll be providing that grab-and-go lunch. 6 feet of social distancing is really the quintessential piece that we're all working on. This is why we have to have these hybrid schedules and A and B cohorts because we can't fit everyone in one room right away with 6 feet of social distancing. We've done a lot of work to make sure we can actually do this. we increased, thanks to our board, our staffing. Thank you for allowing this. We increased our staffing in kindergarten through 5th grade so that we have 6 kindergarten classrooms instead of 5, reducing our total student count from an average of 22 to an average of 18 per class, which is a big deal because then we can get more students in per classroom because we have more classrooms. And that's going to help us out. We're launching in baseline. So again, baseline, if you recall, is the cohorted model, where Group A will come on Monday and Tuesday. Group B will come on Thursday and Friday. We'll all continue to do distance learning on Wednesday, and I'll unpack that model for you in these slides. But we're doing that to keep our groups small so that 6 feet of social distancing is possible. The rooms are prepared for 6 feet of social distancing. You see a great picture of Mrs. Tillinghouse' room right there. That room has been set up like that since November. She is waiting for these children to come back. She cannot wait to have them back in her room. We have spray painted dots, social distancing dots and arrows all around the campus. This campus has structures that will help keep our students safe and keep distance in the hallway. And we're offering outdoor activity and outdoor learning zones for our teachers to book outdoor learning spaces so we can maximize the use of fresh air to, again, reduce the spread of the virus. We also are using very structured arrival and dismissal protocols, which are in our guidebook and we'll be informing our parents about, so that we can stagger people in through the gates and out through the gates to make sure we don't cluster at the gate and, again, break those social distancing norms. These are some pictures from some classrooms that I visited. This is School A. It is currently fully open, and that's a room full of 26 fifth graders. This is also School A with 22 and 19 students in those classrooms. That school is using 4 feet of social distancing. They're in a separate county from us, but that's how they're getting that many people in there. This second school, also in a different county, different from the first one as well. These are in Yolo County, but they are at 70% open, and they have 18 to 22 and 14 to 18. And this is a school here in Sacramento County who is using the hybrid model so that they can keep students in class in the morning and use distance learning in the afternoon. And you can see what happens when you do that. You end up with 6 kids in one room and 8 kids in the 5th grade room. When you're just reopening for the first time and you show these pictures to your staff, I think seeing this room, having not been in a room with children for a year, and then seeing this picture, I think it makes very natural sense to open up in the model with the smaller cohorts so we can focus on personalization for students, so we can focus on our safety protocols. This makes a ton of sense. This will be a great place to start. We call it baseline so we can grow from there. So this will be the model that we'll be using for ourselves. We're very lucky to have adequate ventilations. The 3 schools that I visited, none of them had the same ventilation system that we have because our system is brand new. In fact, one of the schools that I visited told me they're getting bulldozed in 2 years. The building's completely being ripped down. They just got a massive grant to rebuild. They have their ventilation system is nothing like ours. And of the 3 schools, I asked all of them, tell me about your transmission rate. And they said, we've been open since November. We've been open since October. We've had 0 transmissions between students, 0 transmissions between student and staff. And one of them admitted they had a transmission from staff to staff, but under investigation, they found out that the 2 staff members had been collaborating in a room together without their masks on. This is early in October, before people were maybe taking it as seriously as they needed to, and they had no more transmissions since then. So here are these schools with less adequate ventilation, but they're using masking, right? They're using the other layers, so they're using physical distancing and stable groups. Our ventilation system is the top of the industry standard. We use MERV 13 air filters which filter down to 0.05 microns. We have 15 feet or cubic feet of fresh air per student per minute. And this is the big one, right? The exchange rate or turnover rate of the air is 6 times per hour in the classroom. You know, if you talk about going on an airplane right now, and they say the air in the airplane is one of the safest places you could be because the exchange rate is so fast in the fuselage, because the air turns over quickly. It's the same idea for this particular filtration system, that our air filters are working quick to turn over the air and bring in fresh air from the outside every minute. We've also offered our staff, for those who still feel a little nervous about this, that we're willing to purchase them a HEPA filter. We did talk to Dr. Kassiri about this. She said, well, I don't know that it's really any scientific evidence that says that it makes you more safe, but I think whatever makes anyone feel safe is probably worth investing in, and so we've offered that to our staff. Obviously, hand washing and respiratory etiquette is something that we've already started working on with hand sanitation stations all the way across the campus. We'll do hand sanitations at the campus entry, again at the classroom entry, and then regular hand washing at intervals inside of our classroom and every time we leave and come back to our classroom. We have signage that will be going up across the entire campus promoting that, and we'll be doing a lot of family education and promotion with videos and handouts that remind our families to be practicing these protocols. Speaking of family education, we do have this beautiful community agreement that we've developed. We kind of modeled it after two of the other schools that we saw. Actually, all three of them had something like this. And what it just basically says is schools can reopen per the CDC because schools are able to create a controlled environment that helps use these layers of mitigation to make our schools safe. But the reality is schools can't open schools alone. Schools need the community to also be using these layers of safety. And so we're asking our community to help us reopen our school and to keep our school open by keeping our school safe. We're asking our community to read this guideline or this community agreement and sign it that says, hey, as a family, we will try to adhere to these guidelines so that we can help to keep our family safe and keep our school safe as well. And we're very excited about that piece. It makes all of our teachers and our staff feel very comforted to know that our families are going to kind of buy in to this work with us, that it's not all on the shoulders of our staff to keep the community safe. Symptom and close contact screening. This is kind of a big change for our staff. First of all, every teacher I've ever known, comes to school like with a little bit of a headache, a little bit of sniffles. They're like, oh, I can tough it out. We got a big day today. You can't do that anymore. Our staff have agreed they will not come to work with any symptoms, and our families have to agree to the same. We can't send our children to school with a little bit of Advil and a temperature decrease. That is unacceptable in the modern era, and that's part of the conversation and education we have to have with our families. We'll be doing verbal and temperature screening at the arrival to school, and we'll be doing symptomatic observation and referral to the office. And so again, like teachers are used to seeing, hearing a symphony of sniffles, right, in their classroom. But now if we hear students sniffling, we have to do a little investigation. And we're working with Natomas Unified School District. We're lucky enough if there is going to be, if somebody seems to be displaying the symptoms of COVID, Natomas Unified is willing to send out a rapid test response team. And with the permission of parents, we can test students right on campus if that is what we need to do. We've changed our bathroom protocol, so only one person goes into the bathroom at a time. We have a protocol by which you put a little sign on the door so you know that somebody's in there. And we do that so that there's never a need for contact tracing due to the bathroom. We never need to say, oh, when that person went into the bathroom, was anybody else in there? Because that's how contact tracing works, and this eliminates that. So there's been a lot of work in orchestrating these protocols and procedures to keep these kids safe. Obviously, contact tracing reporting has been happening here since November. The law indicated it had to start by January. We started in November. We started this internal dashboard where we report through notifications to all of our staff and vendors any on-campus notifications that need to be made. Again, we've had no reportable on-campus instances in over the last 30 days, which is really interesting because back as the COVID cases were rising in the community, we had a few notifications of people who tested positive, but there was no exposure and no transmission on campus. But in the last over 30 days, we've had no new cases, which is really wonderful to hear. We've also, as I said, had no on-campus transmission from student to student, student to staff, or staff to staff. This last piece is interesting on the 7 layers. It's the last layer we talked about a little bit last week, and we've learned a lot about this in preparations for a discussion around surveillance screening. The transmission rate from student to staff is incredibly low if you're using the other 6 layers of safety, right? If we are wearing our masks and social distancing and washing our hands and not sharing materials and staying in stable cohorts, the transmission rate is incredibly low. However, the reality is that we are as adults, a danger to each other. Most likely, we're going to get it from another adult. And so we have to be vigilant about ensuring our adults continue to follow the top 6 layers of safety. However, we have decided that we will be providing on-campus surveillance testing or screening testing for all of our staff through the Valencia Lab partnership that we have. Valencia Lab will bill directly to our employees' medical insurance because our employees are considered essential workers, and there'll be no copay or no cost to our employees. We will offer this to our employees on a weekly basis while we're still in the purple, and every other week when we're in the red and when we're in the yellow, we will stop doing the screening. But we're working with Valencia Lab on that work, and it is of course voluntary. But look, anybody who's asymptomatic who finds out that they are carrying the virus, that's one less person who will be on campus spreading the virus, and so we think it's a well worth doing. We're also going to assist with surveillance screening for testing students. We do have the ability to send every family who wants to the Natomas Unified School District Clinic. They've really upped their game, and they have far more slots available than they've ever had. Now, not sure that we can rely completely on just screening through Natomas Unified, because not every family may have the means to drive over to Natomas Unified and get that. And so we are actually working with a vendor called C19 Solutions and considering a potential take-home test, which we're investigating right now, which again could be billed either to insurance, Medi-Cal, or to the state for those who are uninsured. And we're working on that partnership, but we do have appropriate means to at least begin this work, and we're pretty excited about encouraging everybody to just increase the amount of testing that's happening in our community. And of course, that is always on a voluntary basis. There are those who do not wish to be tested, and that's okay. We cannot make them. Going over the 7 layers of safety, I'm going to pause. The rest of the show goes pretty quick. That was my longest section, but I do want to get to the part where we're talking about the school day. Are there any questions, thoughts, or concerns about the layers of safety as I describe them and the plans that we have in place? Each of the things that I've described are in memo form and are documented inside of our internal memos system, and each of them is also discussed in our return to school guideline that's produced for our families. It's been updated this last week, and we republished to our website tomorrow morning after this board meeting, should the board approve these guides. Shannon?
Yeah, I think this is a clarification question. For like contact tracing, is that so if someone in the community knows they're infected, is that just like voluntary reporting to us? Yeah.
So I got a little audio glitch on you, but I think you're asking about contact tracing and how does that operationalize inside the school. So what we've asked is for any family who's had a positive case in their family to report that to the school within 12 hours. So if you find out that mom or dad, aunt or uncle, somebody in my household bubble, if somebody in my family has tested positive, the school wants to know about that, and then we will begin contact tracing. More importantly, anybody who's been on this campus is really our main concern. Any student or staff member that tests positive, we need to know about that immediately so we can begin exposure tracing and contact tracing. The guidelines for what contact actually means per the CDC guidelines is less than 6 feet of distance for a total of 15 minutes, cumulative over 24 hours. And so it's really important, again, a really important reason for us to stay 6 feet apart all the time so that we don't create these clusters. But that's the work that we will be doing as we reopen, and we've been doing that since August. I mean, we do contact tracing now. We've had students who've been on campus who've said, hey, I tested positive, and we've done the contact tracing, and that's how we know that we've had no transmission on campus. Was that your question, Shannon? Cool. Sorry, I got a little audio glitch on you. Anybody else?
I was just gonna make a comment, John.
Yeah.
Sorry, I didn't raise my hand. I think it's interesting in weighing against the hearing from teachers who have been in the classroom against with the layers in mind has been really helpful for me, even though I obviously not in the classroom, but visualizing how certain pieces of it do work and can work, and that openness to change, and how each class will sort of develop its own flow with tubs and taking down the paper towels. It was super. I personally felt like it was super practical information. Yeah. And so having listened to that and then seeing your presentation, I can really see how they fit together in terms of adapting to this change. And so I just wanted to acknowledge that, and again, give you a shout out for allowing for that opportunity, because it was just super helpful for me to picture it.
Yeah.
And sort of having this discussion tonight.
It was fruitful to have the teacher panel. I think it opened a lot of our eyes to what's possible, and our teachers are incredibly creative and intelligent and are already processing how they will keep it safe. Ms. Gibbons?
Yeah, thanks, John. I just want to say I'm super proud to see all of the different layers of safety, and there's some layers in there that are not necessarily mandatory that Westlake has chosen to do anyway, and I really, really appreciate that. I wanted to go back. We talked about students, and if they have any symptoms, they should stay home. And I just wanted to know if we are going to provide any assurances in terms of absences and absenteeism and having that exemption for students right now.
Yeah. Well, what you'll see in the model for our instructional model, one of the big benefits of our instructional model is the ability to stay home and not miss a day of school, because we'll be doing live instruction in the morning on campus with my teacher in my little cohort, and then we're going to go to lunch, and then we're going to do distance learning in the afternoon, meaning that these students and these students will be on the same pace. In some of the other models, the pace gets broken, or classes get broken up and go to different teachers. But in our model, what happens is, if you can't come to school because you have symptoms, stay home. You're going to get the same lesson at 12:30 instead of 8:30, right? And truth be told, goes for the teacher too. Teacher stays home. Maybe the teacher can Google Meet into the classroom in the morning and then just distance learn in the afternoon. And again, we can keep the pace of learning going, even though, hey, we're going to have less instructional time than we had before, because we had to break the day in half, and I'll explain that. But this model allows for that type of flexibility. So I think it's really important. We also, in the guidebook, are very clear about which symptoms we're talking about, because it can be confusing. And we want to be very clear with families exactly what we're talking about. And if there's ever any question about that, we also have our phone numbers in there so people can reach out directly to the school and say, hey, should I bring my student to school or not? Any other questions, team? Okay. So just going to talk through some of the things that we're going to need to do, the skills we're going to need to be able to develop for our staff to make sure. Hope. You're muted, but I bet she's telling me to check the email. No? Is that what you're telling me?
Because I hit raise hand instead of unmute, because yes, I was wondering if now might be a good time to check for public comment on the first half of your presentation.
Yeah, good call. There's 3 of them right now. So, okay if I go ahead and open them up? Great.
Yes, please.
I'll take them in order of appearance. Oh, yes. Erica Baumgartner says 3 board members have had their first vaccine. Have the teachers? And yeah. Oh, well, I'll answer it. And the answer was yes. All of our teachers and classified staff all have had access to their first vaccine. We're very proud of that. That every one of our staff members, 134 staff members, including our custodial team and our substitute teachers, have all had access to the vaccine. So a great partnership with Natomas Unified School District. Sorry, I'm not supposed to answer questions, am I?
You're actually okay, because this is on for discussion tonight. So it's not one of those not on the agenda already areas.
Very good. Okay, well, hopefully that was helpful. Is this a board comment? This one says question. I'm assuming it's a question. From Jesse Atwall. When will level 2 orientation be done? That's a great question. So we will obviously open up in baseline on March 13th. We have an April 26th check-in for, and you'll see that in the slideshow later on, April 26th check-in for the rest of the families to see if they'd like to come back. Depending on how many people do or don't come back will depend on whether or not we could then expand to our next level or not. So it'll be a work in progress for sure. We're committed to starting safely, focusing on one step at a time. I know some people want to jump ahead and get a step ahead, and that's awesome, but we are definitely committed to opening up school, which I know was a big concern for everybody, and that's what we're committed to doing is reopening school, and we'll take those next steps as they come. This is a lottery question, so this is not for tonight. Got it, I almost clicked on the wrong one. Okay, and this is a board comment though, and this is from Carissa Richards-Johnson. Reopening school is a team effort, and there has never been a time in Westlake's history that such teamwork has been so critical to every person in our Westlake community. This teamwork is crucial to our health and crucial to educating and caring for our children. I am glad to see the community agreement, put that in quotes, community agreement, and look forward to making that commitment. I really appreciate how it highlights the importance of this shared effort among staff, teachers, students, and families. Thank you, Carissa Richards-Johnson. And just on that note, Dr. Atwal, who was our guest speaker, along with Dr. Kasiri, has been really instrumental in helping us develop this particular line of thinking. Dr. Atwal is a UC Davis a doctor and part of their COVID safety team, and has been adamant to say, hey, it is not only on the school to reopen schools, it is on the community, and community education is a big part. So Dr. Atwal has agreed to do a special coffee talk with me. If I can get Mrs. Husted and myself and Dr. Atwal together, we'll be doing some community education on this topic. So very, very excited about that. Thank you, Mrs. Johnson. Okay, that was the last of that comment, but we'll check back in a minute. I'm assuming that's green light. All right, thank you. Working on my technology here. Okay. So we're talking about skills development. This is. I just wanted you to kind of hear the type of work our staff has to do. Obviously, all of these plans are in place, but we've been holding them on the shelf because we didn't need them yet. Now it is time to execute, and we need time to train. Some of our skills will obviously be front-loaded, but some of them we will iteratively learn as we go forward through these next several months, and we'll have to iterate and make them better as we go. Skills that we'll need to front-load would include, arrival symptom screening for students and staff, on-campus safety protocols, all of them that we mentioned tonight, on-campus mental health protocols for students and staff. People may need breaks because of the anxiety of coming back and things like that, and we have protocols for that. Referral protocols for symptomatic observation. So this is a new thing. We used to just send a student to walk down the hall to the nurse's office for a Band-Aid. Well, how are we getting kids to and from if we're trying to keep everybody in stable cohorts? It's a very important protocol for us from a safety standpoint. Cleaning protocols. We get this great fogging machine that is part of our deep cleaning process. But, you need to clean up your room before we come in and fog. Otherwise, all your papers will get wrinkled from the fog. And how can staff also clean their own surfaces that they want clean? And, of course, preparing for substitute teachers. This is a really big deal for us and something I hope we do very well. We're working in the background on this diligently right now to make sure we have appropriately screened subs to come in and help us keep this school open because we're going to need to have our staff not come to work when they're symptomatic. The big one for our staff, as well as collaborating with our instructional aides, our education specialists, and our administration. Like, if we can't all be around each other the way we're used to being around each other when we're on campus, how will we do that work? And all of that needs to be trained and protocoled and how our students get the services they need. These are those 3 days I asked for, March 4th, 5th, and 12th. And we already have protocols and training schedules built out for that, a little training website with deliverables for our staff. We're also going to be doing some training of our students and our families, right? On March 8th through 11th is our virtual orientation week. It's also parent conference week. So during parent conference week at night, we have the parents talking to the teachers, and during the day, we want our students learning about, how to come back on campus. They'll be learning that through morning meeting and advisory. We'll also be releasing all of these materials in print, but also in video for our families. So if you want to we really would love everybody to make it a family affair to sit down, once a day for 4 days, talk to your students about wearing the mask and the social distancing and all the things we need to do. Then we'll have March 15th through the 19th on-campus training. Our students will go through orientation as they come back to school, and they'll get to learn the protocols for how to be safe on campus. Think about it. Our kindergartners have never been at school. They've never been on campus. So they got a lot to learn. It's very exciting for them. The resource of time, I just want to be clear that this is the big one for us, right? So between February 25th and spring break, for 6 weeks, there'll be no ad hoc meetings. Our DNA, that's our data and assessment team, our PBIS team, our SEL team, leadership team, MTSS, and our professional development will all be stopped. This does not include, obviously, the important meetings regarding students, right? It doesn't include IEPs and 504s. Those are essential meetings, of course. We have the planning time on the calendar. March 3rd is a collab day. We have the 4th, 5th, and 12th. We're asking for the board to authorize us to close for those days. Then we have collaborative days going forward to spring break. And then, for our training purposes, some personal deliverables. What will teachers need to develop? They'll have to set up their classroom. They'll have to get their materials binned out so that they're in little buckets so every kid has their own materials because they can't share materials. There's just lots of little work to do, right? Team deliverables. What are their baseline instructional protocols? What are their scope and sequence? What materials are they going to be teaching in weeks 1, 2, and 3 as we come back, knowing that we want them to focus on community building, but we don't want to let the gas off too hard on the academics as well. And then obviously all of our on-campus training that I alluded to in the last slide. These are all those important dates that are canceled. And the asterisk down there indicates that our staff have all had access to their first vaccine as of today. But we do know that people have a stronger reaction to the second vaccine, especially those with strong immune systems get a strong immune response from that second vaccine. And so a lot of our teachers will have their second vaccine on the 11th. And we've said, hey, if you aren't going to be well enough to work, it's okay. We will support you. And I hope that the board supports our decision to make sure that our staff don't lose sick leave due to the second vaccination, that we've asked them to prepare asynchronous learning materials and to communicate with administration and their families to let us know how that's going to work out. So I'm asking for 3 days of closure. I'm telling you that there may be some async days due to the second vaccine. These are all the stagger steps that are going to be a little shaky leading up to opening, but this is what reopening school looks like, and it looks like this everywhere I look. Natomas Unified is having the same conversations as are all of the other schools that I talk to. We're giving out class lists. We gave them out yesterday. A teacher may see, okay, I've got 12 kids coming back. That could mean I've got 6 and 6 coming back, 6 in cohort A and 6 in cohort B, but it may not always work out that way. You might not have an even split out of the 12 that decided to come back that they were perfectly A and B. So you might have, 8 and 4. So we're trying to take a look at that and see, is there a way to balance it? But because the cohorts are tied to siblings, you can't just go changing all the cohorts. However, if there are going to be cohort changes, if anybody's going to have their little cohort letter changed, we'll let them know before we release the information this weekend. About 60% of our students will be coming back, which is very exciting. And we expect most classes to be 6 to 9 students in these first 6 weeks, although some will be larger. And we asked teachers what they needed, things like, hey, you're going to be wearing a mask. Do you need a little Britney Spears microphone so that you can be heard? And that made some people feel better. Some schools use these desk shields. We found that with such small class sizes, they're not recommended. But we said, hey, if a teacher needs that to feel comfortable to come back and do an excellent job, we're okay with providing those to our teachers. Same thing with the HEPA filter. Again, we have an incredibly adequate air filtration system here, but this is a people business, and we take care of our people, and this is something that we've said is okay to place in the budget if staff feel that they need it. We also provided some resources for our staff, how to set up their classroom per the CDC, manage in-person learning, and cleaning and disinfecting guidelines. And if anybody wants those resources, they're provided as well. Very interesting. They talk about directional flow in classrooms. The last piece here is the payoff. Why are we doing this? It's wild to think that it's March almost, and the students haven't met their teachers in person. There is a magical connection between a student and a teacher. That's why we get in this business. That's why we stay in this business. And to think that our kids are going to meet their teacher for the first time in 3 dimension is a phenomenal thought. We've seen a great increase in mental health need, not just in our school, but in our community, in our nation. And we know that abuse is on the rise nationally. We can't assume that we're immune to that in our community, and that school is one of the number one abuse intervention assets in our community. That we call CPS, we get involved, we know our children, and that's a real reason to consider reopening as long as it's safe to reopen. We want to re-engage students who have not been engaged. Now look, we had 98% attendance, incredibly high engagement. We're seeing academics, but I'll tell you what, every single one of us has at least 1 or 2 kids who are like, if I could just get that kid in front of me, I know I can make magic happen. And so that's part of the benefit. We're helping to train our students, ourselves, for the fall as well. Let's be honest, there's no magic, that's going to happen between now and fall. We're still going to be wearing masks, I'm assuming, in the fall. Maybe 6 feet will become 4 feet. Maybe it won't. I don't know. The sooner we can get these protocols going, the sooner we can make it safe to be on this campus, the more rhythm we can get and the more regular it feels, the more likely that the fall is going to open smoothly. Just seeing their real faces, not their digital, not this Google Meet face with a blurred background, right? To see the real faces and hear their real voices is going to be magical. We like the idea of starting at the grading period. We could have tried to rush and get open by March 8th, but that's parent conference week, and we're like, that doesn't make any sense at all. So we thought, hey, we're opening them on March 15th. It is the first day of the 3rd trimester. We have one whole trimester from front to back to focus on these small groups to make sure that everybody gets what they need from a personalized manner. And finally, the question of when is answered. When we left on this, Gilligan's Island 3-hour tour, we thought it was going to be like, 3 days and we'll be back to school. And then since then, it's been the question of when. Well, the answer is now. March 15th, we have it answered. I'm going to talk about our instructional day. Does anybody have any questions about the trainings that I just discussed, the payoffs, the resources, any of that, or any of the time that's needed to do it?
John, does it make sense to check the public comment real fast?
It's one step ahead of you. Oh, there we go. Yep, looks like I have 2 emails. I'll open them now in order of appearance. This one's from Rocio Owens. It says, hi there. Will there be opportunities to change our survey response? Say we chose to do distance learning now, but after a few weeks we want to be back in school. Will we have the option? Absolutely. It's a great question. And it is on the last slide, so you beat me to it, Ms. Owens. Yeah, we're going to do a 6-week run and then a 6-week run in the 3rd trimester. So we're going to open, then we have a spring break in there, and then right after spring break, we'll throw the survey out there. It's 3 weeks to spring break. We'll come out of spring break. We'll survey families. Hey, how are you feeling? And then on April 26th, we'll come back and you'll have a full 7-week run, the 6-week or 7-week run from there till June 9th for promotion. So yeah, if anybody's sitting on the sidelines and thinks I'd like to sit on the sidelines and check it out, well, then it's okay. You do that. We'll take care of our kids, and then we'll have an opportunity to come back. That is a great question. Oh, Amy, I'm supposed to be forwarding all these emails to you. Don't let me forget for the minutes. Sorry, there's one more email here. It's from Rebecca Montez. Hello, my student is in first grade in a first grade class. I've eliminated the teacher's name. I just felt like I should. I don't know why. Should I read it directly in? Is it okay?
You can make those edits. You're fine.
Okay, cool.
They will be in the minutes though. So,
okay,
but
cool.
I would go ahead and not say it now.
Yeah. When we turned in the back to school survey, my husband and I were expecting to receive our vaccines. Oh, we weren't expecting to receive our vaccines as quickly as we did. I want to be sure she can attend in person 4 days a week if that's what's decided, since we're less fearful. Well, first of all, it's wonderful that you got the vaccine close sooner than you thought. We put on the survey a 2-day option and a 4-day option. I think that's what Mr. Atwall was referring to in his previous comment. We are opening up in the 2-day-a-week option. And then if we get to that 4-day-a-week option by the 26th, it sounds like that's what your family would like to do. But please, anybody who's listening to this, if you want to talk about what you selected and what you would like to select next, please email admin@westlakecharter.com. We will reach out to you. Look, this is your school. We want to make sure we're serving you. And I know we asked you that question. What was it? We sent out that survey 3 weeks ago, and now it's today. And so reach out to us if anybody has a change of heart, a change of mind. We will collaborate with our community for sure. But by opening day, we like to have a lockdown. Like, this is what our number of kids in the class is, because that makes sense for a nice stable opening. And again, we'll open it up on April 26th. But please reach out to us. We'd love to work with you on that. Okay, I'm refreshing just to see. Okay, no other comments, so I will go forward, and then we'll take comments again at the end. So
perfect. Thank you, John.
Yes, ma'am. So let's go into the instructional model here. We're focusing on one group at a time, and this is intended to really reduce teacher burnout. And I put that on this slide for a very purposeful reason. So I interviewed several teachers and administrators from several different schools, the 3 schools that I visited, along with a few other schools that I really get a chance to visit. What we found out was this. The schools that elected to do more than one thing at a time really struggled because it was harder than they thought. And Jed had mentioned this at a previous board meeting. Hey, get good at one thing at a time. Don't try and do more than one thing at a time. Some schools are electing to keep their school day a little longer because they're having kids Zoom in while the other kids are in the room. But what we are hearing from all the people that have tried this is that seemed like the best logic in October. But in reality, those schools who started that in October have morphed or moved away from that or tried hard to do so because it's a more challenging model. Our model is to focus on the children in front of us one at a time. If the kids are in class, we want the teacher fully focused on those kids in class. If the kids are on the screen, we want the teacher fully focused on the kids on the screen. Why? Well, in reality, the first graders need lots of it, and the kindergartners need lots of the teacher attention to facilitate the distance learning even after 7 months. So the idea that the teacher would be able to give that type of attention while attending the kids in class doesn't seem like a solid plan. So here is the plan. On Monday, for example, cohort A comes to school from 8:30 to 11. You have to take the entire school day, 8:30 to 3, and break it in half. The kids in the morning get 2.5 hours. The kids in the afternoon get 2.5 hours. The teachers get a lunch period and a prep period like they always do in school. So cohort A comes to school on Monday. They're with their teacher in the classroom. Now, the kids at home are not just sleeping in. They have independent instructional minutes. Those independent instructional minutes include art, Spanish, PE. They can use Lexia or Freckle for reading instruction, math instruction. The teachers will be providing independent instructional minutes, extensions of the daily lesson or preparation for the daily lesson. So what we like about this, obviously, is if you have 6 to 10 students in a class, what we're finding out, especially from our partners that we talked to at Barrett, when they had these small classes, they were actually able to accelerate the amount of learning that was happening. Because the cohorts were so small, the teacher efficacy increased because it was like instead of teaching a whole class a lesson, they were teaching 6 to 10 kids. And so even though the day was shorter, the learning accelerated and their reading scores actually outperformed some of the work they had done in the prior year. So we're really excited about offering this along with a little grab and go lunch. So then the kids leave at 11 o'clock with a grab and go lunch, and it alternates every day. Every 2 days. On Monday and Tuesday, cohort A is in class, and cohort B and the full-time distance learning students are doing their independent instructional work in the morning. On Wednesday, that's a full distance learning day, just like we do now. So all 3 groups, cohort A, cohort B, and the full-time distance learners, they'll be back together as a community every Wednesday, just like they are now. And on Thursday and Friday, we switch to cohort B being in class in the morning, and cohort A does their independent instructional work in the morning. After that, we have grab and go lunch. The teachers have their lunch. The teachers have a 1 hour prep period, which is part of their work day, so they can prepare and do the work that they need to do. And then we shift to the afternoon schedule. The afternoon schedule is the distance learning portion. You'll see that the morning students get 2.5 hours. The afternoon students get 2.5 hours. Everybody gets their teacher's undivided attention and appropriate instruction for the day. Now, while the cohort B and full-time distance learners are in distance learning in the afternoon, cohort A then has their independent instructional minutes. So that's when they're doing their specialties, art, Spanish, and PE. They're doing their, Lexia, Freckle. They're doing hands-on projects, essay writing, science, social science, and those pieces there. What I love about this model, although it seems like the times are short, I don't know how else to break a day in half and get more than a half out of it. It's half and half. What I love about it, though, is whether your family has the capability of bringing your child back to school or not, you get exactly the same amount of time. It's equitable. In other models, the people who decided to get distance learning got less. They only got 1.5 hours. And the kids who came to school got 3.5 hours. And that's just not equitable or fair when you say it's not the child's fault that they couldn't come back to school. So this model breaks it down, 2.5 hours, plus the independent learning time. The other thing I like about this model is on Monday, at the end of the day, when we all go to bed at night and wake up on Tuesday, we've all received the exact same opportunity, the exact same lesson, and on Tuesday we're in the exact same place. Whereas other models start to get students on different paces. After school, from 3 o'clock to 4 o'clock, we've cleared off all of our meetings so the teachers could have more prep. But also, we are having our virtual learning lab available for our students, just like we do now. So I like that we have still the opportunity for our students to get extra support, both at 12:30 in the afternoon and again in the late afternoon at 3 o'clock. I saw a hand. I have these little models that walk me through it, but go ahead, Hope.
So, John, just real fast, and it may just because it's really small print on my screen. Yeah. So just to walk right through, so it seems to me like on Monday in the afternoon, everybody's still in independent instructional minutes, but I don't know if that matches what you said. I want to make sure that it was really clear.
Yeah, no, I apologize. I've been presenting with these slides all week, and nobody's ever caught that until right now. This is my 5th presentation with this exact same slideshow. No? Yeah, I apologize.
I get the AB thing, but I feel like it's not
let's take a look.
Quite right.
So the A cohort is on campus in the morning, and they're doing independent instructional minutes in the afternoon. The B cohort is doing independent instruction, and this is where they're getting their distance learning, not independent instructional minutes. Let me look ahead and see if I got it on another slide. Gosh, no. Let me go backward. Thanks for catching that. I hope literally the 5th time I presented this slide all week and it hasn't been caught. Thank you.
Well, I thought it was crazy, and then Sean started to stare. Sean, you didn't make a face, but I could tell you were focused on trying to see the small print too, and so I thought I'd go ahead and ask.
Yeah, let me try and explain it with this model here, because this model takes you through 3 different children in 3rd grade, for example, and that way we can clarify. Thanks, Hope. A little embarrassing. I messed up my slide somehow. So on Monday, again, this is Teresa. She's a 3rd grade student. She's in cohort A, and she has on-campus, in-class instruction from 8:30 to 11, and then she goes to lunch, and she goes home, and she works on 30 minutes of specialties, 15 minutes of Freckle, 15 minutes of Lexia, and she has a 20-minute grade-level reading project. Okay, we know what Monday looks like for a 3rd grade cohort A student. In class, lunch, independent work. This is Michael. He's a 3rd grade cohort B. In the morning, he's doing specialties, Freckle, Lexia, and a reading project. But in the afternoon, he's with the teacher doing distance learning. This is Devin. Devin's also a third grader, but Devin's a full-time distance learner, neither A nor B. So this is what Devin's schedule actually looks like every day. In the morning, Devin has the specialties and the independent instructional minutes. And every day in the afternoon, Devin gets a full 2.5 hours with his teacher and the other students who are involved in distance learning. So that is what an elementary school model looks like. The middle school model is a slight tweak. It's the same concept. And I'll just clarify, because middle school rotates blocks, right? They go to more than one class. They're going to do block 1 on Monday and block 2 on Tuesday. And so what that's going to look like is cohort A is going to come in and do block 1 in class, while cohort B does some independent instructional minutes. And then in the afternoon, block A does their independent instructional minutes, and cohort B gets block 1, but through distance learning, and then it rotates throughout the week. This is that example again, where we see Jason, a 6th grader, has math and science in school on Monday, humanities in school on Tuesday, and does distance learning in the afternoon. Independent study work in the afternoon. Whereas Olivia is a cohort B, so on Monday and Tuesday, she does her independent minutes in the morning and then does distance learning in the afternoon. And then this is Isha, and she has full-time distance learning, so she has independent minutes in the morning and distance learning in the afternoon. So a rationale for the plan, because there's so many different plans out there. We like it because it's clearly based in equity for instructional times for all 3 groups. There's no way to give one person more time without taking time away from another group, or increasing the number of kids in class, or breaking up our cohorts or our classes. We considered the idea, well, should we make a distance learning teacher and all the distance learning kids could go to that teacher, then these kids could get more time? However, we've said all year we don't want to break up our classroom communities. We do not want to move students away from their teacher after they've been in a pandemic for a year. We do not want to move teachers away from their students. It's a commitment we've made all year to the social emotional health of our students. And so we think this is the most equitable way to offer instructional minutes to begin with. And as Mr. Atwell mentioned, we will grow from here. We're calling this baseline. And we've already had some teachers say, well, what if I could have kids in class and some of them come in via Google Meet? Take it slow, master your craft, grow from there, and we'll innovate. Already teachers are going there. But we want to start in baseline so that everybody can do this manageably and move forward. Sean?
Yeah, so I just wanted to clarify or make sure that I say these words and get corrected if I'm not right. This is a change from what had been proposed previously, where I think this is what was for like K through 2, there was a cutoff where older children were going to be simultaneous, and that is, we're now doing what was for the younger kids is for everybody who's coming back.
That's right. It was originally a K5 model. This was the K5 model. Now this is the K8 model. However, we've offered our 6-8 teachers, actually we've offered all the teachers, again, the opportunity to innovate from here. We think clarifying for all of our families exactly what's expected from the get-go, as opposed to having separate models and separate times and separate understandings of how school operates. We just felt a little confusing. We thought, let's stick with a baseline model and allow ourselves to grow from there. And so this is the model we resonated with. We also, again, after learning from other schools who started in a model that was allowing people to Google Meet in while some people were in the room and the teacher was masked while they're on the screen and trying to manage kids in class, we saw the teacher burnout. And these are people telling us that they were burning people out in October, November. Our teachers have been in this year now, and it's going to be March. And I don't know, I've worked in schools for a long time. It's an exhausting year to get to March anytime. this particular year, I just want to make sure our people are providing high quality education to the kids in front of them and not having to, they're already working late into the evening right now. I mean, talk to every teacher on our staff. They're working around the clock to do what they're doing. I want to build a manageable model so that they're able to serve our kids incredibly well. And so this is the model we resonated with. But I will take feedback from you for sure. I mean, if it isn't the model that resonates with the board. And these are the things I just spoke to, making sure our staff are able to start with a manageable model, clarity for our families, acts as a substitution model so we can grow from there. If I'm teaching in the afternoon to my distance learning kids, they get my face as opposed to trying to wear the mask while on the screen. It's just barrier in front of barrier to get to our students. And then that 2.5 hours of live instruction then equals only 40 to 90 minutes of independent pieces, which if you take a look at including specialties, Freckle and Lexia, then you'd only need 20 to 30 minutes of actual crafted extension lessons. But these can be paper, digital, projects. I mean, especially as the kids at this point in the year are so project oriented, there's so much project work to do. Our students are doing a lot of independent work by March, April, and May. You go walk into a classroom and they're working on those end of year larger projects at every grade level. And so we think we'll be able to meet these instructional minutes by utilizing this model. Last slide, and then I'll take some more questions. And this is just our action plan. As I told you, we presented these plans to leadership on Monday. Our full staff reviewed the plans on Tuesday. We had a panel of educators and medical experts on Wednesday. You are taking a look at the plans tonight, and certainly I'm open to feedback. We are going to release our reopening plans once they've been approved by the board on Friday, and then we have lots of work to do. Wednesday is a collaborative day. The 4th, 5th, and 12th, we will be communicating with our families that will close school to prepare for our reopening. If that is approved tonight, we've told our staff the campus will be open on weekends. We didn't offer that information. They asked. They said, "Oh, we get 3 days to work on it. Can we get 5? Can we get the weekend?" Because they're Westlake charter teachers and they want this to be brilliant. We will launch our K2 on March 15th, cohort A. We will launch cohort B on March 18th. We will launch our 3-8. That's my fingers crossed, 3-8. It's the 3-5 guarantee, but a 3-8, we're hopeful that we're in the red tier for 5 days at that point. Cohort A on March 22nd and cohort B on March 25th. Our next check-in for families, as was questioned in our comment, is April 26th, which is a 6-week check-in. That is the end of that plan. I'm open up to any comments from the board or from our community.
So before we check the email again or read those in, John, were there any other specific questions from board members for John? I'm not seeing John, and there are no hands raised. Do we have any comments by email?
Yeah, let me take a look. I have one here. It's from Sharice Harper. It says, will the lower grades have a break? It's such a great question. Will they have a break during their 2 hour and 30-minute distance learning time? It's very hard to keep younger kids focused for that long on the screen for instruction. Yeah, one of the things about the distance learning time structure is that grade level by grade level, they will utilize that time. It's not going to be, not every grade level utilizes it as a sit and get, right? That we sit in a room for 2.5 hours and stare at the screen. There's small group breakouts and on and off. So certainly the teachers will be accommodating those needs. I could be speaking out of turn, but I'm pretty sure that as of right now, we don't see any students in the lower grades doing a 2.5 hour stretch right now. So I would assume there will be breaking that up appropriately for our students, maybe pulling small groups, things like that. Thank you for everybody's attention. I know that was a long presentation. I thought, though, it would be important to make sure I got as much information out as possible because we'll have families watching tonight. Any other comments, questions or concerns?
Okay, Michelle.
There we go. Michelle?
No other questions or concerns. I just want to say what a great job you all have done in thoughtful job and planning. I really do also, if I'm looking at this correctly, it looks like the kids that are distance learning are actually going to be able to still interact with their peers that are cohorted back at school too, which I think is really exciting for them. They don't feel like they're losing that connection even with their peers. So I just want to thank you all for being really thoughtful in this process.
Thank you. I'll be transparent. I mean, my biggest fear about the process is the time. I wish I could make school longer, and I think I really want families to hear me when I say I know our teachers will put their full energy into serving our students incredibly well in this model, and I don't want people to get too worried about counting the minutes, because our teachers will pour into our children and they will grow and do well. I wish there was more hours in the day, but when you go, 8:30 to 3 o'clock, there's just not any more time in the day that we can equitably separate that out. But I know our teachers will do a phenomenal job. So let's all support our teachers, get behind them, and be grateful that we're moving in this direction, and just trust that we'll keep stretching the rubber band and moving toward whatever the next level is. So that would be my one. As I reflect on the plan itself, that's my one thought, is that I wish there were more hours in the day.
John, I was just curious, have you heard any feedback on the presentations to staff this week, or just even, I just want to get a sense of how, if you feel like these meetings have been really supported for staff, and that what the thoughts are around reopening at that level. And maybe Ashley or Vasa might be better to answer that.
I'd love to give it a go, and I think John would say the same thing. Everybody's different, people have different feelings and emotions around this topic. And I think the plan that we have in place really does a good job of meeting everybody where they're at. And so the biggest thing that, our families need to know is that our teachers want to see the kids. I was talking to Ro, our facilities guy, today. He's like, "Are you ready? I heard you guys got a couple days off." I'm like, "I'll take the kids tomorrow, Ro, to be honest with you." So that's, how I feel. And I think, most of our staff, would agree. But it's a challenging time for everyone, and everyone's different circumstances, different health circumstances, for sure. And so we just got to respect that and move together as a team.
Yeah, thanks, Boston. Ashley?
Yeah, I'll just add, I agree. I think everyone that I've spoken to, everything Vasa said is kind of where they are. They're processing that schedule. They're like, okay, wait, just in the same way the board was asking questions. They're like, okay, wait. So they're really literally thinking about every single kid. They're like, okay, so how often do I see Hope? And when do I see Michelle? And when is Sean on her computer? And they're just, that was a big piece of yesterday, I think, was the processing of the schedule. Or was that Tuesday, John? What day? Whatever the day that was. And probably still, I actually have a team member. I said, let's talk on Friday after I hear it again at the board meeting and I've processed it more. Maybe I'll have more, I can talk about it better. And so I have a call out to one of my colleagues tomorrow for that. I think that's a big piece. I also know that everyone was just so overwhelmingly grateful for the panel yesterday. They didn't have words. They were speechless in the fact that Westlake even thought about that. I think that just helps us stand out in our community, and Westlake is always amazing at finding ways to do that. But it was very, very, very powerful to hear from teachers and hear from the medical professionals. And they were very just grateful, and sure, they're stressed, but it's like the first day of school. We'll do it 100 times and we'll still be stressed, because they want to get it better than right. They want to make it amazing.
Yeah, my sense is, speaking to the rigor of or the challenge of, restructuring our school days and scope and sequencing. And I've been teaching this unit and it's going to get broken because it's not done there. We're starting on March 15th, or, whatever, all those things. Our staff have that work ahead of them, and it looks like a challenge, but I've heard nothing but like, okay, just give us time, get out of the way, we got this. The bigger thing for me has been the concern around the virus itself. I've been teaching from home where I know 100% of the time I'm not going to catch COVID-19. And now you're asking me to come back to a campus and have hundreds of people on it. However, in the last 2 weeks, a lot of people have been vaccinated. And I got to tell you, I've worked here for, many years now, and I've received many emails and cards and thoughts and texts that says, hey, wow, I cannot tell you what a relief it is to receive that vaccine. I'm so grateful. I'm ready. So while we're not all 100% like assured that we're feeling 100% safe, boy, it is quite a turn from where we were 3 weeks ago or 2 weeks ago when we saw each other last, because the vaccine wasn't totally in sight just yet. So we're making good progress. People need time to process and work. Like Ashley said, what day is it? It was just Tuesday. We're looking at these models,
And John, I'm a long processor. Like I absorb it, but then it hits me later. So I 100% understand that everyone probably needs some more time around it. But I also know that there would likely be big flashing lights or other warning signals if that processing wasn't sort of moving in a positive direction. Does that make sense? So I just want to get a sense that we're basically on the same track right now. Yeah. It just at a different speed.
And to be clear, we've met with every team since then, and we've met with every individual who had previously indicated that they were feeling uncertain about coming back to work because of the COVID situation. And we've, our team has met with every person who's in that situation, and we're talking through it and saying, what do you need to feel safe, and how can we support you? And, again, while we haven't arrived at perfection, we've arrived at that place where we feel like the team is gelling and about ready to do that work.
John, can you just do one last check for public comments, please?
I see none.
Okay. So with that, if there aren't any other board comments, I would look for a motion to approve the reopening plan as presented.
I'd like to go ahead and move for the reopening plan.
Thank you, Nancy. Is that Josh?
Second.
Okay, sorry, you were on my screen, so I just wanted to make sure. Amy, will you please take a vote?
Yes. Hope?
Yes.
Sean?
Yes.
Nancy?
Yes.
Josh?
Yes.
Michelle?
Yes.
Vasa?
Yes.
Ashley?
Yes.
Shannon?
Yes.
And Jed?
Yes.
Thank you, everyone. That brings us to reflection. Nancy, since I forgot you during celebrations, would you mind going first now?
Of course. I am certain that that my reflection is the same as many others for this evening. Very much appreciate just the amount of planning and work that goes into putting together a plan like this. I know that if I were still a parent at Westlake, I would be thrilled to pieces and then some. So I really feel like what we've approved is the best plan that we can put forth, using lessons learned by our community and experts in the field. So much kudos to John and the team for their thoughtfulness in putting this together. So thank you.
Thanks, Nancy. Vasa and then Steve, if you'd like to reflect.
This is a year of work. I like to celebrate the fact we're going back to school. I am excited to see some kids and just meet with them, talk to them. It's gonna be fun.
I can we talked about how Mrs. Batten is excited about high school. Vasa, I can tell you're excited to be back with your kids again. And it feels really good. Steve and then Sean.
It's been an interesting year, to say the least. And while we have had kids on campus through BASE and the distance learning camps, it's going to be really great to have more kids back on campus. So looking forward to it.
Thanks, Steve. Sean and then Shannon.
I'd just like to commend the team on not sort of sitting on their laurels, like the commitment to continually improve plans that have already been made and haven't even been implemented, but yet let's take a look at them and see what we can do better and see what we can learn from other people who are maybe further along in this process. And I really appreciate that effort on the part of everybody who was part of it.
Thank you.
Thanks, Sean. Shannon and then Michelle.
Yeah, I mean, I think you guys have the thoughtfulness of it. I hate that I'm always just comparing to my friends who teach at other parts of the state in them Westlake situations. For whatever reason, my audio is sorry. You all look very concerned. But I don't know. I think it's coming from my other. Sorry. But that we're not just like putting up some tents and telling the teachers they have to teach outside, or telling them they have to go back with no preparation, with no advance warning, without being brought along for part of the process. So it seems like even though there's still some apprehension, that it's being addressed, and teachers and families are moving forward at the pace and the choice of the path that is best for them.
Thanks, Shannon. Michelle and then Josh.
Yeah, I just want to reiterate my appreciation that I expressed earlier, and just take a moment to appreciate where we're at, which is we're getting out of it. You know, we're one step closer to being through the pandemic. So I just want to just rest in that for a moment too.
Yeah.
Thanks, Michelle. Josh and then John.
Yeah, I mean, I'm just going to reflect what everybody else is reflecting on. But John, what your team can do while on vacation for a week, it's very impressive, to say the least. And I also wanted to throw out there, while you're getting things open first day, if you need an extra set of hands, helping direct traffic, helping kids find where the classroom is, let me know. I'm happy to come in and help out in whatever capacity you need me. So keep that in mind. If you're running short and you just need an extra set of hands, I'm here for you.
Excellent. Thank you. Is my reflection out?
It is, sir.
Yeah. All right.
And then Jed will be after you.
Okay. Great. Yeah, I guess my reflection is that, at a time when there is really no right answers, it's really wonderful to have a group of people like yourself who are willing to ask good questions and suspend any disbelief and say, okay, we've arrived at a place that we think is a good next step. What is the next right step? And I appreciate your support as a board. It's easy to pick apart anybody else's plan. That is so easy to do. But it's, I think, harder and maybe sometimes more courageous to say, this is a good plan, and we know we can make it better together going forward. And so I'm excited about the work that we're about to do with our staff. I really appreciate the support of the board during a time when, we'll see how this plan works on March 15th, and we'll make it better on March 16th, and we'll continue to make it better, until March of next year. So anyway, I'm just very grateful for the board.
Thanks, Jed, and then Ashley.
Just thrilled at continued no drama. Keep going.
Ashley, and then Amy.
My reflection is two. One is just, the always thinking about the preparedness of Westlake teachers and the staff, the board and the parents being on board with that. I think our families know and understand, and it's really clear that the board does, that the teachers want time to be even better than they can be for the kids when the kids walk in the doors. And this amount of planning that the admin didn't probably have off, allowed them to be this prepared. And that kind of preparedness is going to come from our teachers with those couple of days of planning. And it's going to do what Jed said, no drama. So that's one reflection, or very much help that. My other reflection was the engagedness of our families. I got curious, and the little pop-up said John was live on YouTube, and I clicked it on my iPad, and when I heard so many comments coming in, and our parents are busy right now. They're working all day, and they're helping their kids learn all day, and we've got 33 families sitting watching us and engaged in this meeting and submitting questions. And if there was ever a meeting that we needed that, it was this one. And so I just really am grateful to those families who are so engaged right now, to make sure we can support them and help them feel comfortable too.
Thanks, Ashley. Hey, Amy, before you go, do you mind if I call on Michelle? She raised her hand.
No problem. Go for it.
Perfect. Thank you. Michelle.
I'm so sorry. A question just popped up in my head, though, and it was a wow moment for me. Like, are we wearing uniforms when we go back to school?
Wow. Yeah, we are. In fact, we got some links to some vendors that are currently uniforms are on sale, and we're like, okay, if this gets approved, we got, hey everybody, we're wearing because your uniform from last year doesn't fit. We also would love to do the uniform locker piece where people could drop off uniforms from last year that are, we'll make sure they're laundered and we'll distribute them out because, my goodness, right? Yeah, great question. We're doing uniforms. We have plenty of masks. We want everyone to bring a mask to school, though, but we will have plenty of masks. If you happen to get out of the car and don't have your mask, that is a uniform piece that we will have for you.
So no pajamas, kiddos. No pajamas.
No pajamas anymore. It goes for staff, too.
Yeah. Real shoes. I have so many friends buying shoes because they have not bought shoes. Ashley, you lowered your hand. You good?
I was just laughing about the uniforms because we may have pulled if you talk to the Patel boys right now, they would be like, yep, we pulled everything out. Liam got Aiden's if they fit. Right. And we sat and ordered last night because Michelle, after working with the staff yesterday, I went, oh, wow. And I need to order now. So yes, they are on sale though in a lot of places. That's right, John.
Yeah.
Okay, Amy, your turn.
I will just say that we've been working towards this day since March 12th, 2020. And I remember we all gathered in the Matterhorn, the whole admin team. It started right then and there, drilling away on how do we reopen what we thought would be 2 weeks later. And I know John well enough to know that since March 12th, he's not slept, focusing on the health and safety of all of us. It's said that I'm the mom of the school. Well, he's very much the protector and the father of the school and the staff and the students and all of us. So I think this is a great time for me to just tell him, thank you for looking out for us for 360 some odd days and not sleeping. I know you haven't slept.
Thanks, Ada.
Which tags on to my reflection, Amy, very nicely. So while it was great to work at the clinic today and get my vaccine, the highlight of my day was for the first time since I believe 8th grade spoken word last year, I got to see John Ike in person. And that feeling makes me think of Voss and his comment about having students, right? You don't know how much you miss interaction with those who are such valued partners until you're face to face and you realize how much you've missed it. So, John, what I really appreciate about this plan is I feel like it very safely brings our community back together where we will have that additional layer of support and interaction in place. I echo Josh completely. If you need me anywhere on campus, I will be there. And as well as please, again, if you want to volunteer or are available to volunteer for the shot clinics, to reach out to Amy. And I'm sure that they will be able to put you to use because there was some fear today, right, about as schools go back, making sure we have enough volunteers to continue staffing the clinics. And so I know the community could really use your help. Sorry, that was a long reflection, but I wanted to wrap that all in. So with that, I will go ahead and adjourn the meeting at 8:22. So thank you, everyone, for